Hi there, I'm Dr. Frank Johnson from Sports Medicine Ultrasound, here to demonstrate a new product called the ViSonic Piloter. This is a tablet-sized machine that comes with a wide array of attachable ultrasound transducers. It's a touchscreen machine. On this L15-4NB probe, we've got two buttons. These are controlling both the depth, so depth increase, depth decrease, and this one over here, that's freeze and unfreeze. I'm going to show you what the image looks like just when I turn on with an MSK setting. Now, Hannah is quite a slender person, so you see that this 4 centimeters of depth is a lot more than I need. So rather than reaching over awkwardly over the patient, using these buttons, I can simply decrease my depth here and get a nice, beautiful image of her supraspinatus tendon and her subacromial bursa. It's currently in its full screen view. If we take it out of full screen, we can see that there's many other options that come up here. Now, one of the ones I frequently go to is it's currently optimized, the frequency is currently optimized for general imaging, but I want to switch to high resolution imaging. Sometimes we'll switch back to general. We've got our left-right invert there. I've got my gain down here on the bottom of the screen. I have my TGC if you want to do to manually change different layers of the gain. I like that it overlays on the image. So I'm now in full screen here, and if I were to do an injection into the subacromial bursa, let's say I want a bit more depth because my patient's got a thicker deltoid, I can increase my depth using the buttons on the probe. If I wanted to decrease my depth, obviously the same. If I wanted to save an image, I simply tap the save image. That paused the video recording. I'm going to restart the video recording because I like to record these procedures and put it in the patient's medical chart. So I'll complete my injection, then let's go on and have a look at the elbow. So now what we're going to do is we're going to go and have a peek at my patient's elbow. So let's say we're going to look at a lateral elbow, so common extensor tendon. We've got enough gel here. I'm going to line up the lateral epicondyle in the center of the screen. I'm going to decrease my depth by pressing these buttons. And what we can see here is the lateral epicondyle in the center of the screen, my radial head in the center. I'm going to hit record on this. I'm going to go into full screen. So as you can see, I've just got such a much larger image. I really like that image. There's no need for Doppler here. There's no vessels of interest. So I'm simply going to scan through. I'm going to go in a short axis and come up on the extensor tendon to see if there's any abnormality there. Nothing's popping out. Now, what else could I do here? Well, I could look at the triceps tendon. So from this view, I can simply go into full pronation and look at the dorsal aspect of the distal biceps just here as it attaches onto the radial tubercle. And when I perform these injections, I'll come from the ulnar side over towards the radius. Now, being a tablet, you can actually rotate this 90 degrees. To do that, we simply hit the rotation button. It does a quick little restart. And while it's restarting, I simply stand over here, rotate it on its side, and let's say I now want to change my probe. Changing out the probe is as simple as this. To attach the probe, it's a simple click. End up back live again. Now this is really important for a larger patient. Let's say I've got to do a hip joint injection and or an abdominal scan, and I need a lot of depth. In this case, I'm going to demonstrate a glenohumeral joint injection. With a curved probe, I can see the humerus there, the glenoid more in the center of the screen, and with some gentle external rotation, we can see the humerus rotating adjacent to the glenoid. I think it's a really nice complement to the larger, much more capable ViSonic Navi, but this is a great entry-level machine for you.